Hi there, I'm Dr. Stephen Phelan. Welcome to this new video. Today, I have another video in my webinar questions answered series, and this video is from the Vertical Dimension Case Studies webinar, and this is from Dr. Sharma, who would like to know what material did you test this in? And I believe what Dr. Sharma is referring to is what material did I use to test the changes to the occlusion design that we did when we altered the vertical dimension in the provisional restorations or the trial restorations. And for case one from the program, from the webinar, the lower arch, I did additive bonding to the lower incisors. So I built up the lower incisors based on the wax up from the mounted study models using just direct composite. And that could have been left for a number of years, I believe, because they look pretty good and they were designed in the proper occlusion and everything was good. The posterior lowers, I built them up with overlays, and that could have been direct composite as well, but I ended up using ProTemp Plus, or whatever version of ProTemp they had about 15 years ago. So we built overlays based on the diagnostic wax up in ProTemp to test this change in the vertical, because I was changing the vertical by building up the lower posteriors. In the upper, we were only really doing the upper anterior, and we were replacing old bridge work. So I used a ProTemp Plus, or whatever the version was then, a ProTemp provisional bridge. And the patient was in that for, I don't know, it was a number of months. It was maybe 4 to 6 months total, and it worked out fine. Even the lower ProTemp Plus overlays, I did those on unprepared teeth because we were opening the vertical. They held up really well over the course of a number of months. So that was case one. Case two, I went direct to ProTemp Plus provisionals. Again, I'm very comfortable with that material, used to using it. I used Luxatemp a little bit too. On some cases, we don't have the shade we want in ProTemp Plus, although they've recently added another bleach shade, so that should help us. But I'm comfortable carving these. I use the XT discs, and you make a shell from the duplicate model of the wax up that I use to create in-mouth provisionals that I remove, carve, and cement in with various different cements that we decide to use depending on the needs of the case. Case three was also a ProTemp type of provisional, created from a shell of the diagnostic wax up, made in the mouth directly on the preps, removed, carved, and cemented. That's generally the go-to system that I use. I do show in my occlusion design program some indirect techniques, creating the provisionals on outside, models of the preps. And that works great too. It's just not as efficient as using the preps themselves in the patient's mouth. Another technique that would be good to use is milling PMMA provisionals or composite provisionals for the long-term cases direct in a milling machine. If you took either a model of the preps, scanned that, or a scan in the patient's mouth with one of the scanners that are available today. So these cases were all older cases that I shared on the webinar because I wanted to show cases that have a long-term history, and I have cases, from 20 years plus. So I like showing some of these older cases. Because of that, they were all done with ProTemp Plus or something like that, not used with milled provisionals. I've done some milled provisionals, very nice, but that's a newer technique. At least it's a newer technique with all the CAD/CAM workflow. So that's basically what we used. I hope this answers your question, Dr. Sharma, and thank you for watching this video. If you're interested in one of my webinars, you could go to vdoseminar.com, and enroll in the Altering the Vertical Dimension Case Studies webinar. And we'll talk to you soon. Take care. Thanks.